Welcome to the Nutrition Research Update from the Renaissante Institute of Integrative Medicine. Hi, I'm Dr. James Machino. Our topic today is menstrual cramps, or dysmenorrhea. Now, dysmenorrhea refers to menstrual cramps that are felt usually in the lower abdominal area and the suprapubic area, and they're usually most severe between 1 to 3 days prior to menstruation. Sometimes the pain will radiate to the thighs and very often to the lower back. What percentage of women develop these sort of menstrual cramp problems? About 50% of women in their childbearing years are troubled by them. They cause some discomfort that's noticeable. But about 10% of women experience really incapacitating pain, where they often will have to miss work or it will really interfere with their normal life. So what's the cause of these severe menstrual cramps? Well, if the egg isn't fertilized after ovulation, then the body has to prepare for menstruation to shed the thickened endometrial lining. And the destruction of the endometrial lining releases a hormone called prostaglandin series 2. And prostaglandin series 2 is what causes the severe muscular contractions and uterine contractions. And if they're severe enough and frequent enough, it leads to pain. And prostaglandin series 2 often promotes inflammation in the area and constricts blood vessels, leading to lack of oxygen in certain areas. And that also contributes to a lot of pain as well. So MRI studies have proven that women that have dysmenorrhea, that's really severe, have more intense and more frequent contractions than women who don't have severe menstrual cramps. So these contractions are really at the root of it. And it's prostaglandin series 2 that seems to be the chemical that's producing the severity of the problem. So the medical treatment has been anti-inflammatory drugs like ibuprofen and naproxen. But of course, if you take these drugs on a regular basis, they can cause stomach irritation, they can cause erosion to the intestinal tract, leading to ulceration and internal bleeding. They damage the liver over time. They damage the kidney over time. It's well documented. They can even lead to high blood pressure problems. So not having to rely on those synthetic drugs is desirable if you can get around it. The other approach has been to give women oral contraceptive pills or birth control pills, which sort of block the whole ovulatory process, and that sort of overrides the whole problem. But again, even with birth control pills, the risk of blood clots increases, especially in smokers. Over a longer term, it can cause liver damage, high blood pressure, cause glucose intolerance, sort of diabetic and pre-diabetic states. It's not really the best use of oral contraceptives in my view. And I say that because studies have shown that there are natural, non-toxic therapies that have been proven to be helpful that a lot of medical doctors don't bring to the attention of the patient. So I'll give you some examples. Chiropractic care, double-blind studies have shown that chiropractic care, treatment of the low back with chiropractic treatment, significantly reduces many instances where menstrual cramps are a problem, and it sort of blocks the cramping and also reduces blood levels of prostaglandin series 2. It's unbelievable to see it, but it works. So how does it happen? Well, the nerves from the lower back actually sweep around into the area around the uterus and the genitalia, and they supply a lot of the muscles around the uterine area. And if there's nerve pressure in the spine that's building up, it can irritate the nerves. The nerves fire with greater frequency and intensity, and that can cause more muscular contractions in the uterine area, aggravating the menstrual cramp problem. It sort of amplifies the problem in the presence of a highly sensitive uterine tissue that's already going through this menstrual process. So proper chiropractic care actually removes that nerve irritation. It sort of tones the volume down. By realigning the joints and stripping out all the adhesions and calming those nerve pathways down, you end up with less severe and less frequent contractions. And amazingly, chiropractic care of the low back has been shown to decrease the levels of prostaglandin series 2 in a very natural way. So all women with menstrual cramps, if the problems are severe enough and they're really bothering you, should really have a low back assessment from a chiropractor. They're the only one who is qualified to see if you have any nerve impingement problems that are interfering with the quality of your life in this respect. There are also supplements that have been proven to work. The combination of black cohosh with soy extract and gamma arosinol, this sort of 3-in-1 combination. Black cohosh contains active constituents that have proven antispasmodic ability decreasing the spasms and the contractions that are severe to reduce menstrual cramps. That's proven. Soy isoflavones and gamma-arosanol help to naturally balance some of the female hormones, sort of toning down the hormonal fluctuation. Supplementation with vitamin E and vitamin B6 has also been shown to be useful, helping to block prostaglandin series 2. And the use of acupuncture, good documented evidence, clinical studies proving its effectiveness in decreasing dysmenorrhea. So often a chiropractor can treat the low back with their hands to correct the alignment and also use acupuncture on you at the same time. So you can sort of kill two birds with one stone with certain types of chiropractic care. Now, there's also some dietary modifications that are worth knowing about. Some foods contain raw materials from which the body makes more prostaglandin series 2. You want to avoid those foods so you don't build up prostaglandin series 2 in your system. So decreasing your intake of high-fat meat products and certain vegetable oils, staying away from deep-fried foods and trans fats, keeping the amount of blood sugar that you have into a lower range. So these high glycemic foods that are super sweet and super refined can aggravate the problem. Alcohol promotes inflammation. That aggravates the problem. Other foods help the body make the more anti-inflammatory prostaglandins, which are helpful. So having fish and a combination supplement with fish oil, borage seed oil, and flaxseed oil all in one capsule allows the body to make more of the anti-inflammatory prostaglandins, which help to solve the problem. And using olive oil instead of other types of vegetable oils, very useful. And choosing lower fat dairy products, things that are milk and yogurt that are 1% milk fat or less, keeps some of the bad fats out of the diet that can aggravate inflammatory processes. So in the text below, you will see the exact diet and supplementation program that I recommend to women to prevent and manage menstrual cramp problems or dysmenorrhea. If you have this problem, and you should seek an assessment from a family chiropractor and implement the dietary and supplementation regime that's outlined here to help eliminate or greatly reduce the condition. If you know someone who suffers from severe menstrual cramps, I would urge you to forward this Nutrition Research Update newsletter to them so they can look at the information for themselves. So I hope you found this helpful. Thanks for watching, and I'll see you next time.